So when did it start snowing in New York?
So I saw the first flurries, I want to say yesterday. It was
Right.
a sad day.
Yeah. We actually had some here, I think it was 2 days ago. And
Really?
yeah, in North Carolina, when it snows, we shut down. Yeah, it's like, but
Did
we're kind of
anything
shut
stick?
down anyhow, right? So it doesn't,
Did anything stick at all, or?
oh, no, it was just like we saw it in the sky, and by the time it hit the ground, it was just water.
No
So,
good for anybody. I mean,
nope.
the grass, though. The grass,
There you go. There you go. That's the positive way of reframing it, right? Yeah.
of
But now
course.
we're back up in the 60s, so it's just
Yeah,
bizarre.
this weather is all over the place.
Yeah. Yes, it is. All right. Well, I'll tell you what, I'm going to get set up so that we can get started.
All right.
And I will do a little introduction, and I'll read your vital details so I get everything right. And we'll just dive right into it. So here we go. Hi, everybody. I am Dr. Cynthia Bulik, or Cindy Bulik, and I am the principal investigator of the Eating Disorders Genetics Initiative. And I am very excited about our guest today because this is a topic that we don't hear enough about. And I'm excited that we're one of the first people to hear about it. So my guest today is Brittany Davis, soon to be Dr. Brittany Davis. Brittany is a fourth-year dental student, and officially it's at the Columbia University College of Dental Medicine.
Yes.
And you are also a content expert for the National Center of Excellence for Eating Disorders. And your content area is all things related to dental and oral health. So welcome to EDGI Talk, Brittany.
Thank you so much for having me. I'm so excited to be here.
All right, let's dive into it. So I guess a lot of our viewers are probably wondering, why do we have a dentist on EDGI Talk today? And you're really interested in this field, but if you could just take us back to what got you interested in being involved with eating disorders in dentistry, that'd be a great place to start.
Absolutely. So back in college, I had a very close friend that ended up developing a pretty severe eating disorder. She developed anorexia, and watching, just a friend I knew before this developed, and then her struggle throughout that battle and how severe it really had a toll on her, just never really left my mind after that. It was, eating disorders were always something that I knew about and, in theory, but I feel like seeing it up close, it really hit home that this is very, very serious and, potentially fatal if not treated. And so after leaving college and going into dental school, eating disorders was on my mind since then. I already had a bit of an idea that dentists could have some sort of role in the space, and so I was looking forward to learning about that. And when I got into dental school, I realized that the curriculum is not very much so dedicated to eating disorders specifically, and I ended up having to do my own research to answer those questions. And at the end of the day, I realized, how many dentists out there are going to take time to do all this research to answer the same basic questions that I had? Likely not many. So, this I think is something I need to pursue and try to, bring all together.
Awesome. Okay, so I see two directions we could go. And let's start out with just talking about, what are the dental manifestations of eating disorders?
Absolutely. So there are quite a few, surprisingly. One of the most well-known manifestations is low saliva flow, or otherwise known as a dry mouth or xerostomia. And there are several reasons for why that could be the case, whether it's because you're taking an antidepressant like SSRIs, that's a known side effect. Chronic dehydration can cause a dry mouth, so fasting, diuretic or laxative use, or chronic purging can all cause you to be dehydrated. And the reason why low saliva is so problematic is because we really rely on saliva to clear out the bacteria in our mouth, to help them and keep them from sticking to our teeth and causing cavities. And in addition, saliva contains bicarbonate, which is a nice neutralizing agent and helps our teeth to fight against an acid attack, whether that's acidic foods we're bringing in or anything at all. And so low saliva, dry mouth is probably the number one biggest issue that we see. But in addition to that, we also see things like erosion, the wearing away of teeth due to acid. You can see oral thrush, which is a type of fungal infection. It comes from low saliva, not clearing out that that organism, as well as potential malnutrition or nutrient deficiencies. There's a classic parotid gland enlargement. If you see chronic binging and purging episodes, you get sort of squarish structure to your jaw. And then other types of mucosal trauma, whether it's from current purging or using any sort of object to initiate that episode. And so all those things would be present potentially.
Okay, so dehydration, I know that can go across all three eating disorders: anorexia, bulimia, binge eating disorder, because all three of those groups might be on antidepressants or using laxatives or diuretics or whatever. So you could see that in all three for sure. Now the acid, I always think about acid being associated with purging.
Yeah.
Is that the primary reason why they get excess acid in their mouth, or are there other reasons as well?
There are other reasons. So that is the first that many of us would think about, which is the stomach acid. And we would call that intrinsic acid, acid from our own selves. But there are sources of extrinsic acid, things that, don't originate from ourselves. So diet, number one, if there's a lot of diet soda intake or, citrus fruits, lemons, all sorts of, acidic foods you can be bringing in will really have an effect. And then in addition, bacteria, when they colonize on our tooth surfaces, and we call that plaque, when they start to build up, bacteria secrete acids themselves as their own byproduct. And so that is also another way we're exposed to acid.
So it's a lot more complicated than just purging.
A little bit.
Yeah.
And it affects far more people than just those who have a type of classic bulimia presentation.
Right. So when someone comes into your office and you do an exam, is there just a characteristic pattern that you can see? Is there something, that alerts a dentist to the fact that their patient might have an eating disorder?
Absolutely. So, obviously nothing is 100% guaranteed, but there are certain patterns that seem to recur more likely than not. So if it's a source of intrinsic acid and you have been having cycles of binging and purging, likely you'll see erosion on the inside surfaces of your upper arch of your top teeth. And if it's a source of erosion from extrinsic acids, foods that you're taking in or bacteria that have colonized, you'll see it more so on the lower arch and on the occlusal surfaces where we bite between our two teeth.
Yeah.
And it will look like the tooth is just kind of weathered away a little bit. So if you had a filling in that tooth, that filling would remain tall and the rest of the tooth around it would start to be at a lower level.
And can that be confused with any other source for those patterns, or is that pretty characteristic and typical just of eating disorder?
So it's pretty characteristic only because there's not too many other sorts of instances that could cause that pattern. However, the one exception being acid reflux. You could see a similar sort of pattern on the inside surfaces of your top teeth from reflux, especially at night.
And we're actually seeing a lot of reflux in people with eating disorders too. So it's not like they're mutually exclusive conditions in any way. So that would be like a double whammy.
Oh yeah.
Potentially.
Just continue to, make the problem more and more progressive.
Yeah. So one of the things that, my patients talk about often is, is there something I can do to preserve my teeth when I do have bulimia, when I am binging and purging or whatever? Is there a recommendation?
Absolutely. There are so many things that can be done. First, we have to be realistic. Nobody goes from, struggling with any sort of a problem to just cured the next day. So, we need to have some sort of advice to give for those who are in the process of, working on recovery. And so the biggest thing we would like to advise is chewing on sugar-free gum. It stimulates the saliva flow by chewing, and it helps prevent the dry mouth and all the symptoms that come beyond that. And if chewing on gum is not enough to stimulate that saliva, then we have prescription artificial salivas that we can give via the office. We also recommend drinking a lot of water, as much as possible, and specifically multiple sips throughout the day, as opposed to just one big, jugging, just getting that whole big water bottle down at once throughout the day is much better. In addition, one common misconception is wanting to brush right after an episode. We discourage that because number one, if you've brushed within about 30 minutes after an episode of vomiting, you can spread the acid, but also the teeth are already demineralized and weakened, and those toothbrush bristles will actually be abrasive to the tooth and hurt it even more during this vulnerable time. And it needs about an hour before it's a little bit tougher again. So we would say just rinse with water or swish with any sort of alkaline or bicarbonate solution would be protective against the acid.
And this is like after a purge, right?
Correct.
I think that's really important. And I've been watching The Crown, right? And so there are all these episodes where Princess Diana binges and then she purges, and then the next scene she's brushing her teeth.
Yeah.
So, you know, I think they need a dental consultant on The Crown just to have them don't do that, you know, for a public health message. Yeah. But I think you're right. I think that's like the first instinct that people have.
Yeah.
Huh.
And it's a great instinct in theory, you know.
Right.
Clearly it shows that somebody is concerned about their oral health and that they're trying their best to maintain it, and that's lovely. But there are better ways to go.
Better ways. So let's actually go over it again, because I think this is like such an important point that I want to hammer at home. So it's like at least an hour and after a purge to brush your teeth. Chewing on sugar-free gum is a good one afterwards, and swishing with like baking soda or something, right?
Mm-hmm. Or even just water. If you don't have baking soda available, even water is still far better than nothing.
Right. So those are, you know, if people take anything away from our talk today, you know, that's probably a really important message. You also mentioned prescription artificial saliva. There's over-the-counter artificial saliva as well. Is that okay for people to use if they can't get a prescription?
Absolutely. Absolutely. Again, any sort of benefit in the right direction is much better than nothing at all. So absolutely recommend over-the-counter as well.
Okay. Any other oral or dental issues that you see in people with eating disorders that we should be aware of?
Yeah, so if you're looking at different sort of age populations, if you're looking at an older population who has developed an eating disorder, you are worried about things like their periodontal health. So just in general, as we get older, our bones become a little bit weaker, a little less stronger, and that applies to the bones in our face and our jaw as well. And so eating disorders exacerbate periodontal disease, and especially in an older population, that can become very present. And what that would look like is the bone of our jaw actually resorbing a little bit around our teeth, meaning that, number one, we're going to see recession. When you see kind of the root of your teeth a little bit starting to be exposed, that yellow bit at the bottom, that'll become more and more prominent. And then in very severe cases, the teeth are no longer being held very tightly around much bone anymore, and they start to become wiggly and loose. And they can potentially fall out on their own if, you know, it is not, if there's no intervention before then.
And can you detect that just by looking, or do you have to have an x-ray in order to figure that out?
So you certainly would need an x-ray to have a clear diagnostic, you know, view of what's going on. However, if you ever have that sensation that your teeth feel a little bit loose, or when you chew on things, it feels a little unstable, that is a classic sign. That means, you know, go jump to the dentist right away.
Right.
So we can intervene before, you know, it gets too severe.
Okay. I thought of something else, and you and I didn't talk about this ahead of time, but I've seen a couple patients, and this might not be the right word to use, but it's almost like they're addicted to getting their teeth whitened. You know, and it's like it becomes almost an obsession. And talk to us a little bit about, you know, different types of teeth whitening, and if there is a danger in becoming addicted or obsessed about whitening your teeth.
Absolutely. So I think, you know, we all want our teeth to be that classic pearly paper white, which number one is not realistic because teeth naturally have a little bit of yellow tint. That shows that a tooth is perfectly healthy. The overlying enamel of our tooth, the outer layer, is white, yes, but the dentin underneath that, which is just a bit softer, is yellow. And so I would say, first and foremost, if you have a little bit yellow to your teeth, do not worry. You are perfectly human and healthy and normal. And also, whitening can be a little bit damaging to the teeth. So whitening is only recommended for teeth that are just very healthy and strong. teeth that have already been hurt a bit by erosion, you know, that acid erosion we were talking about, where the outer enamel layer is getting thinner and thinner over time, that whitening is going to hurt it even more, and it'll likely cause sensitivity. And then you'll be that person who says, oh, you know, when I drink a glass of cold water, my teeth really hurt, or anything.
Bite into an ice cream cone or something
Yes.
like that. Yeah.
Yes, absolutely. The more that dentin is less protected and exposed, the more sensitivity we have, and whitening would really make that worse. And also to say, if the yellowing of the teeth is due to erosion and dentin is inherently yellow, then whitening isn't the best option to go about trying to reverse that.
Right, because that would the whitening only affects the enamel, right? Not the, You know, is it fair to blame Hollywood a little bit on this? But seriously, we always talk about like appearances and, thin ideals on TV. I think we've got tooth ideals on TV, right? Too, right?
Oh yeah. So I would say do not become obsessed with what you see on TV, because what it looks like on TV is not actually as it appears. Maybe it's not very well known, but in Hollywood, those bright, white, perfect, perfectly rectangle teeth smiles are most likely than not veneers. That's not even a natural shade of white that an actual tooth can get to. And so veneers and, a prep of veneers across all the teeth is extremely common in terms of just business and show production and TV and whatnot. And so you are almost using whitening products to try to attain that, when in reality it's impossible.
It's not attainable.
Exactly. It was fabricated. Yeah.
Are they permanent? These veneers thing, are they permanent, or is that something that they put in like before they go in front of the camera or something like that?
So a veneer requires a little bit of prepping of the tooth, which means you kind of drill off the outer layer of the tooth a bit, shave it down, and then you're gluing on a sort of fake shell instead. And so it's not as invasive as a crown, which is when, if you have a very deep cavity and you have to get a crown on top, it's similar to that, and it's a lot thinner and, less prep, but that is the same sort of concept. And so once you have shaved those teeth down to get veneers, you can't go back. And veneers do not last your entire life. I hope I'm not doing anybody a disservice. And veneers are lovely, especially in cases where, maybe you have one specific crooked tooth or teeth that are different sizes. There's use for them. However, it takes a lot of, serious thinking, because let's say a veneer lasts about 10 years before it can be expected to maybe fall off. So now that's a 10-year subscription, and veneers are pretty pricey. And also,
I was going to say, it's got to cost a lot too, right?
Yeah. So I
had no idea.
Yeah.
Because I've often wondered, like, how did they get such perfect teeth? But but that means they're actually like physically altering their biology in order to achieve a certain look.
Yeah. So now there has been advancements in dentistry, and I believe there are veneer techniques that require minimal to almost no prep.
Right.
But again, the typical veneers do require, prepping some of the tooth, and once you take it away, it can't come back.
It's not coming back. Yeah. Wow. Okay. Anything else that we need to know about the impact of eating disorders on teeth and oral health?
Oh goodness. I would say it can certainly impact your aesthetics, which is not something that maybe one would really think of. So kind of going back to that example of an older population who maybe has had erosion, what happens is that their two jaws start to come closer and closer together because the teeth are shorter and they're still trying to touch each other, and that causes a sort of collapsed look. If anybody's ever seen, maybe if you've had a grandparent that has dentures, and when they take their dentures out and their face has that sort of classic look, that is what your face kind of starts to mimic as well. It goes and prints in that direction the more your teeth have been worn down, and your face is also coming a little bit closer together. And then on the opposite end of the spectrum, if we're talking about a younger patient who's had that same sort of erosion, their bite will not collapse, but instead when they close their teeth together, their front teeth will still be open. They won't
Oh,
touch at all. And so that's what we call an anterior open bite.
right,
And so, yeah, there are certainly some pretty major changes to the way just your face is presented.
right.
Um, yeah.
That go well beyond just your teeth, your whole physical appearance, right? So early on when we started talking, you had hoped that you would embark on your sort of learning, your dental learning career and learn some stuff about eating disorders and dentistry, but you weren't presented with as much material as perhaps you would have liked to.
Yeah.
So what is the dental profession doing now in terms of educating young upcoming dentists? And if not enough, what should they be doing? What do they have to change?
Exactly. So we certainly aren't doing enough, and that's dental schools and hygiene schools across the board. It's a topic that is currently in need of addressing. We do know that there are oral symptoms that come with eating disorders, and that is a part of the dental school curriculum, but it's just a very small fraction of it. There have been just a handful of studies conducted across US dental schools to see if the amount of material presented on eating disorders was sufficient for a dentist to go out and practice effectively with that population. And the answer is most certainly not. Not enough at all. And if you're graduating as a student and you feel very weak in this topic area, what's the likelihood that you're going to, put yourself out there and try to talk about it anyway, especially given such a sensitive topic. So we really need to add it into the curriculum. And dentistry as a whole is on its way. We're talking about things like how diabetes can impact your oral health, or how being HIV positive, or substance abuse. And so we're slowly integrating in these other interdisciplinary topics. And I think eating disorders is the clear next step we need to take.
Yeah, and also, you mentioned antidepressants early on, and I hadn't really put two and two together that the dry mouth associated with antidepressants, and that actually covers a whole lot of different mental illnesses.
Exactly.
So the psychiatry dentistry interface really needs to be bolstered a little bit as well.
Absolutely.
And, I have also worked with patients who have gone to the dentist sort of not knowing that there's a characteristic pattern associated with an eating disorder, and the dentist hasn't been very sensitive in pointing out that he or she could recognize this pattern. Do you have a recommendation for all the dentists out there? If you do see this characteristic pattern, what's a good way to bring this up in your practice so that your patient doesn't run away and never come back again, right?
Absolutely. So my biggest recommendation is to go in with just as much empathy as possible, and also with the mindset that, I'm a dental professional and I'm trying to help this patient receive their best possible oral health care status. And so to do that, I need to find the underlying issues that's causing the presentation of these oral symptoms. And so I would almost say, look at it with a sense of compassion, and that I'm looking at this patient and I do see this classic pattern and maybe a few other signs that makes me think, this might be somebody who's struggling with an eating disorder of some type. The compassionate response would be, I'm concerned about your oral health. I want to see you improve. I want to see your smile just light up. And so I, have some suggestions that I think might help in the long term. One of those would include, working with this other department, whether it's psychiatry or psychology, and addressing this whole other component that's hurting your oral health care now. And how can we work together to get you into a better space where you're not coming into the clinic with, these same problems. We can get them resolved for good.
Yeah, the two things, the empathy and then compassion, I think that is the most important piece when it comes to opening the conversation. And I think a lot of dentists are afraid to even start that conversation because they're not 100% sure what the next step is.
Absolutely.
Right.
There has been a little bit of research as well, polling dentists as to why they have not brought up eating disorders in front of patients that maybe they've even suspected. And there are quite a few reasons why, the biggest one being lack of knowledge. Dentists say that they felt they didn't get, much education in dental school, and so they don't know enough to bring it up now. Scared of offending the patient. What if they get it wrong? What if the parents of a minor get upset. You know, not knowing where to refer next or any sort of official screening protocol.
Ah, is there an official screening protocol?
So now this might be a better question for you, but I do know when I was trying to do my background search and get some answers, it seems that the SCOFF questionnaire was a pretty basic, just straightforward way to at least get the conversation going. Not to
Right.
say that it's by all means the most, you know, just
Sensitive or yeah.
exactly, but simple enough that maybe a dentist can start to get, you know, dip their toes in the water.
Is anybody developing a dentistry specific one?
Not as of yet. No, that is not, that has not been brought up.
Because that's a really interesting idea, because I know the National Center of Excellence for Eating Disorders is working on a screen for primary care, but it might be really wise in parallel to do the same thing for dentistry, because the questions might be a little bit different, right?
Exactly, and it would be a first of its kind.
Oh, somebody needs to do a PhD.
Somebody, you're
Somebody.
correct.
Yeah, no, I actually think that's super important. And, you know, on the clinician side, you know, I always think about, you know, putting together a multidisciplinary team. And I'm going to be really honest with you, and I'm going to offend you, I'm sure, right now, because I don't usually think about adding a dentist to the multidisciplinary team for the treatment of people with eating disorders. But after talking to you,
Yeah, that's very normal. I mean, even myself, before, you know, before college, I also had no clue to put two and two together. And so I would not say that's offensive by any means.
So we should, you know, the clinicians who are paying attention, the, you know, the psychologists and the social workers and the psychiatrists and PCPs, you know, we should really have it be more front of mind, you know, making sure that our patients are monitoring and keeping up with their oral health care, especially since we know that, you know, often they will avoid it because they are afraid of being called out by a dentist.
And so in addition to there being oral symptoms that present, I think the way a dental practice is set up is also pretty ideal for helping identify early patients that may be showing signs of eating disorders. So I think it's twofold in why dentists should be included on the team as well. I think they can add a lot of value in a space that isn't quite being particularly hit just yet.
Right. Yeah. And generally you see your dentist pretty regularly.
Exactly.
Right.
On average, most people see their dentist twice a year. They stay with the same dentist for years. So we've got a long-term continuity of care across dental specialties, whether it's pediatrics treating a very young population, orthodontics treating teens, general dentists with adults and beyond. We're covering all age ranges, you know, men and women. And, you know, if, you know, you can get a patient in the practice and establish this really trusting relationship, it might be a great opportunity for a patient to want to open up about such a sensitive topic.
Orthodontics. I didn't think about that. I've been thinking dentist, but I think about like all three of my kids had braces, right? And, you know, we had this long-term relationship with our orthodontist, but I never talked about this topic with her, despite the fact that this is my life. But, you know, they see their patients more often.
And document follow-up of, you know, how are these oral symptoms progressing or resolving?
Right.
Yeah.
Oh, this is exciting. This is like this whole area that has been neglected. I mean, it really has been neglected, and we need to get more dentists interested and orthodontists and all sorts of people who work with oral health to do more work in this area.
Absolutely agree.
How do we do that?
Now, that is a great question. That's what I'm personally working on. That's why I'm here and, you know, working on certain other projects to spread the awareness and, you know, kind of make documents that put it all together instead of somebody else having to read through hours of research like I had to do.
Like you did.
But beyond that, I mean, we have to get an update to the curriculum, just some sort of standardized just piece of information that all schools should be giving to their students, and potentially offering CE courses to practicing dentists now who can still, you know, learn and begin the screening protocols despite being in practice for who knows how many years. And I'm sure there are far more incentives than that too, but we just have to get the information out there.
It's a good start. What are the projects that you're working on now?
Yep. So right now I'm working with, I've got a great mentor, Dr. Kathleen Pike here at Columbia. She was actually the very first faculty here that heard my idea and said, huh, I think you might be onto something. And so she and I just took off, and through her, I was able to reach out to several board members of the Academy for Eating Disorders, which is an international group. And I had hosted a sort of uh, Zoom call just like this before Zoom was as popular as
Thing, yeah.
pre-COVID. We're still using Zoom, and just proposed to them these sorts of ideas that I've been talking to you about. And so now I will be amending their medical standards guide in terms of what dentists should be doing in this space. And then of course the NSEED research group that, Yep, and that came after. And so now I'm the oral health care consultant, just trying to spread what I've learned. And that's essentially what it is just what I've learned and trying to teach others.
Right. Kathy's wonderful. I'm so glad she listened to you when you spoke up, but I would imagine Kathy would be the first person who would go, yep, you're right. We got to do something there. That's great. And, you know, if there's anything else that NSEED can do, you know, please let us know, because it's a great platform, you know, to try to get more information out there for sure.
Absolutely.
So anything else that we haven't touched on that you want to make sure we hit before we close off for today?
Certainly. So there is. I want to first say that there seems to be a pretty natural fear of a lot of people if they're worried about their dental health and they kind of already see that things aren't looking so good. It makes them want to not go to the dentist even more because they're embarrassed or they're ashamed, and they don't want, you know, the dentist to have to, you know, confront or acknowledge, look at how bad I've let it get. And I just want to say, let that go completely. We are so happy when anybody walks through those doors, especially when it's somebody who hasn't been to the dentist in the last 30 years. Especially, we want to celebrate that even more because that means it took that much more of a push for you to get here today. And so we are not here to judge. We are not looking at the state of your teeth saying, "Ooh, this is bad." By no means do we ever think that, because there's so many solutions at every stage, whether it's just an initial cavity, maybe it's progressed to a root canal, maybe the tooth does have to, you know, be removed, but then we're looking at, you know, maybe a bridge, maybe an implant. There are always options to get that smile back to where you'd be happy with it. And so never be ashamed of where you're at, because most likely than not, you're not as bad off as you think you are. At least that's been my experience. So that is first and foremost. And then second, kind of a little shout out to dental schools. Dentistry can get very expensive, which is something that kind of weighs heavy on me. And it really prevents a lot of people from, you know, being able to afford the care that they really need for full rehabilitation. And so I highly encourage anybody at all, if that's a sort of concern, come to your state's dental school. We offer much reduced prices because we're slower. However, we are monitored all the time by full-time faculty and specialists in the area. They check us at every step of the way. And if anything, they're even more critical, and they make certain that nothing is signed off on until it is held to a standard of care that is not just acceptable, but very well done. And so if you're willing to spend a little bit longer in the chair, it still can be some great work you can receive for a much more affordable price.
I think that is so important. You know, and if you think about the number of people who don't have dental insurance and can't afford it and stay away because of that. And, you know, what I always tell people is if you go to a dental school, or, you know, if you go to a training, you know, school, a training university or med school, you know, you're not just having one person look at you. Yes, you're having a trainee look at you, but you have other eyes giving ideas about what's going on with you as well. So you're actually getting more bang for your buck in some ways, you know.
It is it's a very rigorous check that it's gone through. So there are a lot of eyes that are making certain that it's done well. Absolutely.
Awesome. So helpful. So I'm going to mention a couple things just in terms of websites. So, we're talking all about dentistry today, but, we're here as part of the Eating Disorders Genetics Initiative, or EDGI. Please go up to the website to www.edgi.org. Tells you all about the genetic study. Would love to have people participate. And follow us on social media at, we're pretty much every platform. We're at EDGI Study. And in Spanish at EDGI Estudio, Estudio. And let's see, do we have, I know you're on LinkedIn, Brittany, or do you have other social media channels that you want to direct people toward, or are you a smart person and stay away from them?
I have social media and I don't even post or update them. So it's so boring. I won't waste anybody's time, but LinkedIn, I do try to keep up to date.
That's great. And we're going to keep our eyes on you in terms of, helping change the dental field, and we'll help in whatever way we can, because I think this is such an important avenue in. When I think about my relationship with my dentist, which has gone back a lot of years, she knows me well. Our orthodontist knew our kids well. This is such a natural fit to be part of our multidisciplinary team. We really need to work to make that happen for all of our patients with eating disorders.
Absolutely. And this already, inviting me to come speak here has been a huge help in and of itself, just being able to get some of this information out there to those who might not have heard about it. So thank you so much.
And thank you so much for being here. All right, take care, everybody. Bye-bye.
Bye.